Expanding the universe of forensic medicine and forensic pathology in Manila, present realities, challenges, and futures. Introduction, universes, dimensions, and the forensic mindset. Across philosophy, theology, and metaphysics, the idea of multiple universes, from the many mansions of the New Testament to the multiverse of modern physics, captures a profound truth. Reality is layered. Every person, institution, and society operates within overlapping dimensions of experience. We each inhabit personal universes shaped by our histories, values, and roles. Families have their own gravitational fields. Professions form their own constellations of norms, language, and identity. Forensic medicine and forensic pathology in Manila constitute one such universe, complex, under-resourced, indispensable, and often misunderstood. It is a universe that intersects with law, public health, ethics, governance, trauma, and the everyday lives of citizens. Yet it remains peripheral in the public imagination, invoked only during crisis, scandal, or tragedy. To improve this universe is not merely a technical project. It is a cultural, political, ethical, and educational undertaking. It requires shifting mindsets, strengthening institutions, and integrating forensic thinking into the civic DNA of Manila. It demands that lawmakers, law enforcement agencies, medical institutions, and ordinary citizens recognize forensic medicine not as a niche specialty, but as a pillar of justice, governance, and human dignity. This essay explores how to expand, strengthen, and future-proof the forensic medicine/pathology universe in Manila, its present challenges, its systemic gaps, and the pathways toward a more integrated, ethical, and scientifically grounded future. Second, the present universe, mapping the landscape of forensic medicine in Manila. Manila's forensic ecosystem is a mosaic of institutions, professions, and legal frameworks. It includes forensic pathologists, a very small number, many trained abroad; medico-legal officers, often general practitioners with specialized training; PNP Crime Laboratory, NBI Medico-Legal Division, DOH hospitals and LGU health offices, CHED regulated forensic science programs, Supreme Court rules on evidence and medico-legal testimony, local prosecutors and courts, human rights bodies and NGOs, community-level responders, and barangay systems. This universe is functional but fragile. It operates with dedication but often under strain. It is scientifically capable but structurally limited. And it is essential to justice yet frequently invisible. To improve it, we must first understand its gravitational challenges. Third, core challenges. The gravity wells. Holding the system back: 1. Severe shortage of forensic pathologists. The Philippines has only a handful of formally trained forensic pathologists, most concentrated in Metro Manila. This shortage creates bottlenecks in autopsy capacity, quality assurance, training and mentorship, court testimony, policy development. Without a critical mass of experts, the universe cannot expand. Tatlo pa lang ang certified forensic pathologists sa Pilipinas. Tatlo pa lang ang certified forensic pathologists sa Pilipinas. Tatlo pa lang ang certified forensic pathologists sa Pilipinas ng Philippine Society of Pathologists. Dalawa. Fragmented institutional ecosystem forensic services are distributed across multiple agencies with different mandates. PNP focuses on criminal investigation. NBI handles national-level and high-profile cases. DOH hospitals handle clinical forensic work. LG/US handle death certification and public health surveillance. This fragmentation leads to inconsistent standards, variable documentation quality, delays in medico-legal reporting, confusion among families and law enforcement. 3. Underinvestment in forensic infrastructure. Many facilities lack modern autopsy suites, digital imaging systems, histopathology support, toxicology capacity, DNA and trace evidence integration, proper cold storage. Infrastructure is the skeleton of the forensic universe. Without it, the system collapses under pressure. 4. Limited public understanding and cultural barriers. Many Filipinos view medico-legal work with fear, suspicion, or misunderstanding. Cultural beliefs around death, privacy, and shame can hinder consent for autopsy, reporting of violence, cooperation with investigations, trust in forensic findings. A forensic universe cannot thrive if the public sees it as alien or threatening. 5. Legal and procedural gaps. While recent laws and Supreme Court rules have strengthened forensic practice, gaps remain. No unified national medico-legal service, no standardized training pathway for medico, no standardized training pathway for medico-legal officers, variable quality of medico-legal documentation, limited integration of forensic science in court procedures. 6. Ethical and trauma-informed deficits. Forensic work intersects with the most vulnerable moments of human life. Yet many systems lack survivor-centered protocols, trauma-informed interviewing, gender-sensitive procedures, clear ethical guidelines for medico-legal officers. Ethics is the moral gravity that stabilizes the forensic universe. Without it, the system risks collapse. 4. Expanding the universe. Strategies for systemic improvement. To improve the forensic medicine/pathology universe in Manila, we must think in layers: structural, cultural, educational, legal, and personal. The following strategies form a multidimensional roadmap. A. Structural expansion, building the physical and institutional universe. 1. Establish a National Forensic Medicine Institute, NFMI. A centralized autonomous institute would standardize medico-legal practice, train forensic pathologists and medico-legal officers, provide independent science-based services, serve as a hub for research and policy, reduce reliance on law enforcement-controlled medico-legal systems. This aligns with global best practices, for example, Japan, South Korea, Australia. 2. Create a Manila Forensic Medicine Network, a citywide network linking DOH, hospitals, PNP and NBI units, LGU, health offices, universities, private laboratories. This network would harmonize protocols, share resources, and ensure rapid coordination during mass casualty events, disasters, or high-profile cases. 3. Invest in modern forensic infrastructure. Priority upgrades include digital autopsy suites, 3D imaging and postmortem, CT, histopathology labs, toxicology and drug testing facilities, secure evidence storage, digital chain of custody systems. Infrastructure is not a luxury, it is the backbone of justice. B. Educational expansion, growing the human universe. 1. Expand forensic pathology, training pathways, Manila needs, local fellowship programs, scholarships for overseas training, joint programs with universities abroad, faculty development grants. A universe grows when its stars multiply. 2. Standardize medico-legal officer training, ACHEDDOHPNPNB. A unified curriculum should include injury interpretation, documentation standards, courtroom testimony, trauma-informed care, ethics and human rights, digital evidence handling. This creates consistency across institutions. 3. Integrate forensic literacy in schools and universities. Forensic thinking should be part of civic education. Critical thinking, evidence evaluation, scientific reasoning, understanding medico-legal processes. A society that understands evidence becomes harder to mislead. C. Cultural expansion, integrating forensic thinking into the public mindset. 1. Public education campaigns. Use media, schools, and community programs to explain what forensic medicine is, why autopsies matter, how medico-legal officers work, how forensic evidence protects the innocent, Normalize forensic science as a public good. 2. Trauma-informed, survivor-centered approaches. Shift the narrative from fear to support. Respectful communication with families, clear explanations of procedures, compassionate handling of remains, confidentiality and dignity. When people feel respected, trust grows. 3. Use digital platforms and YouTube. Your dual-niche forensic education channel can demystify medico-legal work, explain laws and procedures, highlight ethical practice, showcase Manila-based case studies, non-graphic, build public trust. Digital storytelling expands the universe faster than any textbook. Legal and governance. Expansion aligning the universe with policy and law. 1. Advocate for a National Medico-Legal Service Act. This law would professionalize medico-legal practice, standardize qualifications, ensure independence from law enforcement, provide stable funding. 2. Strengthen Supreme Court rules on forensic evidence. Enhance admissibility standards, expert witness guidelines, digital evidence protocols, chain of custody requirements. Courts shape the gravitational laws of the forensic universe. 3. Integrate forensic advisors into legislative committees. Forensic experts should guide justice reform, public health policy, disaster response planning, human rights legislation. Science must inform lawmaking. Ethical expansion, strengthening the moral universe. 1. Develop a national code of ethics for medico-legal practice. Include conflict of interest rules, standards for impartiality, guidelines for interacting with families, confidentiality protocols, human rights commitments. 2. Establish ethics review boards in forensic institutions. These boards ensure transparency, accountability, protection of vulnerable populations, oversight of medico-legal decisions. Ethics is the compass that keeps the universe aligned. Personal universe. Expansion, empowering individuals. 1. Forensic professionals. Encourage lifelong learning, interdisciplinary collaboration, mental health support, reflective practice. A strong forensic universe begins with resilient practitioners. 2. Law enforcement officers. Train them to respect chain of custody, document injuries properly, understand forensic limitations, avoid contamination of evidence. Police are the first gravitational force in many cases. 3. Lawmakers. Help them see forensic medicine as a justice tool, a governance tool, a public health tool, a human rights tool. When lawmakers understand the universe, they fund it. 4. Ordinary citizens empower them to recognize the value of evidence, demand transparency, understand medico-legal processes, participate in civic forensic literacy. A forensic literate public strengthens democracy. 5. The future universe, vision. 2035 and beyond. Imagine Manila in 2035. A National Forensic Medicine Institute stands as a regional leader. Every major hospital has a forensic unit. Autopsies use digital imaging and AI-assisted analysis. Medico-legal officers follow standardized trauma-informed protocols. Courts rely on scientifically validated evidence. Lawmakers consult forensic experts regularly. Citizens understand and trust forensic processes. Forensic pathologists are no longer rare but respected pillars of the justice system. Your educational platforms help shape public understanding and civic engagement. This is not fantasy. It is a possible universe, if we build it. 6. Conclusion. Expanding the universe. Together, the universe of forensic medicine and forensic pathology in Manila is at a crossroads. It can remain small, fragmented, and misunderstood, or it can expand into a powerful force for justice, governance, and human dignity. To improve this universe, we must strengthen institutions, invest in people, modernize infrastructure, reform laws, build public trust, embed forensic thinking into culture, uphold ethics and compassion, empower every personal universe, professional, familial, civic, to value evidence and truth. In metaphysical terms, universes expand when energy is added. In civic terms, forensic universes expand when society invests in truth, science, and justice. Manila's future depends on it. Pinalalawak ang universo ng forensic medicine at forensic pathology sa Maynila, mga hamon, kasalukuyan at hinaharap repusyatan, panimula. Mga universo, dimensyon at ang forensic mindset. Sa Biblia, binanggit ni Jesus na sa langit ay may maraming mansyon. Sa metaphysics, may konsepto ng multiverse, maraming mundo, maraming dimensyon. Sa araw-araw na buhay, mayroon tayong sariling mga universo, personal, pampamilya, profesional. At para sa ilan, kabilang ka rito, Noel, may universo ng forensic medicine at forensic pathology. Ang universong ito ay hindi lamang tungkol sa siyensya ng katawan at ebidensya. Ito ay tumatawid sa batas, kalusugan, kultura, trauma, etika at pamamahala. Ngunit sa Maynila, madalas itong hindi napapansin, lumilitaw lamang kapag may krisis, kontrobersya o trahedya. Kung nais nating pagandahin at palawakin ang unibersong ito, hindi sapat ang teknikal na solusyon. Kailangan itong maging bahagi ng kamalayan ng publiko, ng mga mambabatas, ng law enforcement at ng bawat pamilyang Pilipino. Ang sanaysay na ito ay naglalatag ng kasalukuyang kalagayan ng forensic universe sa Maynila, mga hamon na humahadlang dito, mga estratehiya para sa pagpapalawak at kung paano ito maisasama sa mindset ng lipunan at pamahalaan ikalawa. Ang kasalukuyang universo, ang landscape ng forensic medicine sa Maynila. Ang forensic ecosystem ng Maynila ay binubuo ng iilang forensic pathologists, medical legal officers, PNP Crime Laboratory, NBI, Medical Legal Division, DOH hospitals at LGU health offices, SHED-regulated forensic science programs, prosecutors at korte, human rights groups, barangay-level responders. Ito ay gumagana, ngunit madalas ay kulang, hati-hati at hindi sapat ang suporta. Ikatlo, mga pangunahing hamon, ang mga gravity wells ng sistema isa, matinding kakulangan ng forensic pathologists, iilan lamang ang formally trained forensic pathologists sa buong bansa. Dahil dito, bumabagal ang autopsy capacity, kulang ang mentorship, limitado ang research, napipilitan ang mga institusyon na umasa sa non-specialists. Tatlo pa lang ang certified forensic pathologists sa Pilipinas. Tatlo pa lang ang certified forensic pathologists sa Pilipinas. Tatlo pa lang ang certified forensic pathologists sa Pilipinas. Tatlo pa lang ang certified forensic pathologists sa Pilipinas ng Philippine Society of Pathologists. Ang PNP at NBI ay walang certified forensic pathologists sa kasalukuyan. Although merong mga certified pathologists sa PNP, di pa certified as forensic pathologist. Ano ang ginagawa ng mga agencies na ito to upgrade their universe? Dalawa, hati-hating institusyon. Iba-iba ang mandato ng bawat ahensya. PNP, Criminal Investigation, NBI, National Level Cases, DOH, Clinical Forensic Work, LGUS, Death Certification. Nagbubunga ito ng hindi pantay na standards, kalituhan sa proseso, delays sa medical legal reports. Tatlo, kakulangan sa makabagong pasilidad. Maraming pasilidad ang kulang sa modern autopsy suites, digital imaging, histopathology, toxicology, DNA, integration secure evidence storage, ang infrastruktura ang gulugod ng forensic universe. Apat, limitadong pag-unawa ng publiko. May takot, hiya at maling akala tungkol sa medical legal work. Dahil dito, ayaw ng ilang pamilya sa autopsy, hindi agad nagre-report ng violence, mababa ang tiwala sa proseso. 5. Gaps sa batas at proseso. Kulang pa rin ang T, Unified National Medical Legal Service, standardized training, consistent documentation, digital chain of custody. 6. Kakulangan sa trauma-informed at ethical approaches. Kailangan pa ng survivor-centered protocols, gender-sensitive procedures, malinaw na ethical guidelines. Ang etika ang moral gravity ng forensic universe. Ikaapat, pagpapalawak ng universo, mga estratehiya para sa pag-unlad structural expansion isa. Itatag ang National Forensic Medicine Institute, NFMI. Magbibigay ito ng standardization, training, research hub, independence mula sa law enforcement, stable funding. Dalawa. Bumuo ng Manila Forensic Medicine Network, isang network ng DOH hospitals, PNP at NBI-LGU, universities, private labs para sa mabilis at pare-parehong koordinasyon. Tatlo, modernisasyon ng pasilidad kasama ang digital autopsy, tatlong D-imaging, histopathology, toxicology, secure evidence systems. B. Educational expansion. 1. Palawakin ang training pathways. Kailangan ng local fellowships, scholarships abroad, faculty development, international partnerships. Dalawa, standardized training para sa medical legal officers. Dapat kasama ang injury interpretation, documentation, courtroom testimony, trauma-informed care, ethics, digital evidence. Tatlo, forensic literacy sa paaralan at komunidad upang maging bahagi ng civic education, critical thinking, scientific reasoning, understanding evidence. C. Cultural expansion isa. Public education campaigns. Ipaliwanag sa publiko. SOR. Ano ang forensic medicine? Bakit mahalaga ang autopsy? Paano gumagana ang medical legal system? Dalawa. Trauma-informed, survivor-centered approach. Kasama ang malinaw na paliwanag sa pamilya, respeto sa dignidad, confidentiality. Tatlo. Digital platforms at YouTube. Ang iyong dual niche channel ay maaaring magpaliwanag ng batas, magbigay ng non-graphic forensic education, magturo ng civic literacy, magbuo ng tiwala ng publiko, legal at governance expansion isa. National Medical Legal Service Act. Upang professionalize ang practice, standardized qualifications, bigyan ng independence ang forensic services. Dalawa. Palakasin ang Supreme Court rules on evidence, kasama ang expert witness standards, digital evidence protocols, chain of custody. Tatlo, forensic advisors sa legislative committees upang maging evidence-based ang policymaking. Ethical expansion isa, National Code of Ethics for Medical Legal Practice. Kasama ang impartiality, confidentiality, human rights commitments. Dalawa, ethics review boards para sa safety, transparency, accountability, protection of vulnerable groups. F. Personal universe expansion. Isa. Para sa forensic professionals, kailangan ng lifelong learning, mental health support, interdisciplinary collaboration. Dalawa. Para sa law enforcement, kasama ang tamang documentation, respeto sa chain of custody, pag-iwas sa contamination. Tatlo. Para sa lawmakers, dapat makita nila ang forensic medicine bilang justice tool, governance tool, public health tool. Apat. Para sa ordinaryong mamamayan, bigyan sila ng forensic literacy, civic empowerment, tiwala sa proseso. Ikalima. Hinaharap. Manila 2035 vision. Isang Maynila kung saan may National Forensic Medicine Institute, may forensic unit ng bawat ospital, gumagamit ng digital autopsy at AI, standardized ang medical legal documentation, forensic literate ang publiko, evidence-based ang batas, mataas ang tiwala sa forensic system, at ang iyong educational platforms ay bahagi ng civic transformation. Ika-6. Konklusyon, sama-samang pagpapalawak ng universo. Ang universo ng forensic medicine sa Maynila ay maaaring manatiling maliit at hindi napapansin, o maaari itong maging isang malakas na puwersa para sa hustisya, dignidad at mabuting pamamahala. Upang mapalawak ito, kailangan natin ng mas matibay na institusyon, mas mahusay na edukasyon, modernong pasilidad, mas makataong proseso, mas malinaw na batas, mas mataas na forensic literacy, at mas malalim na etika. Ang universo ay lumalawak kapag may enerhiya. Ang forensic universe ay lumalawak kapag ang lipunan ay namumuhunan sa katotohanan, siyensya at hustisya. Presently, the UP College of Medicine in Manila ay nag-offer ng Masters in Forensic Medicine kasama riyan ng Monash University ng Australia. Mga doktor pa lang ng mga pathology departments ng mga medical schools sa Manila ang pwedeng mag-enroll. Noong nandyan pa ako sa Manila, pag merong namatay na tao sa mga foreign vessels na nakadaong sa Manila, sa Singapore pa nila dinadala ang patay para ma-autopsy. The idea of a Forensic Pathology Institute, 1996, sa Manila ay bunga ng aking education, trabaho, and travel at stay sa Singapore, Taiwan, and Australia ng humigit kumulang ng 4 na years, 1992 hanggang 1996.